In early 2020, COVID-19 brought our world to a sudden standstill. We watched in disbelief as a deadly new virus, SARS-CoV-2, decimated lives in Wuhan, China, then Italy, moving swiftly to countries around the globe. Lockdowns followed, and soon the virus would tear through lives and livelihoods.
Experts fear
Rumor and fear spread as fast as the virus itself. People needed someone to turn to. Across the globe, scientists became the vanguard of the global response to the pandemic. In South Africa, a ministerial advisory committee on COVID-19 was established with Professor Salim Abdul Karim as its chair. Viewers heard Prof. Karim make meaning of swift-moving science with clarity and empathy. He rapidly earned the public's trust. As the pandemic continued to rage and misinformation multiplied, Prof. Karim's was a voice of reason. He became a familiar face on local and global news networks. A champion for evidence-based responses, human rights, and global vaccine equity.
In our years of dealing with HIV and tuberculosis, we know that it's not simply that you have good science. It's the ability to communicate that. It's the ability to share that with the public so that they can be empowered.
Given your concerns about the possible spread,
in late 2021, the Omicron variant is identified, with features that signaled a new chapter in the COVID-19 pandemic. The journal Lancet called on the Karims to communicate its significance to a pandemic-weary world. The paper was the first epidemiological description of Omicron and would become one of CAPRISA's most cited papers.
What makes your work so impressive is not just its scientific rigor, which it has. You have also been a global leader at connecting the dots between research and social and political action for change.
This global health leadership role has been described as unparalleled for a single research institute.
A huge impact on the healthcare service.
CAPRISA scientists serve in eminent positions on a large number of evidence to policy advisory bodies, actively contributing to global health. CAPRISA's track record of scientific excellence in contributing to global health has deep roots, especially in the prevention and treatment of HIV/AIDS. More than 20 years ago, Professor Qureshi Abdul Karim had shown the importance of prevention in young women who are the hardest hit by HIV/AIDS in Africa. Viral genetic sequencing in a large rural study later confirmed that sex between adolescent girls and older men led to ongoing high rates of HIV.
So until and unless we can stop infections in young women 15 to 24, we will not be able to realize the goals of an AIDS-free generation, the end of AIDS, or even attaining epidemic control.
In 2010, CAPRISA presented the landmark results of its 004 trial at the International AIDS Conference in Vienna.
Another way of looking at this is a 39% lower incidence rate in the tenofovir gel group.
CAPRISA's scientific breakthrough on reducing HIV in women received a standing ovation, the first of its kind for a scientific conference.
Today is a day to celebrate Africa, CAPRISA. I am so happy is our collaborating center is coming with this news today in this conference. It changed completely the face of what we are doing.
The news that a vaginal gel could provide significant protection against HIV infection made world headlines. It was proof of concept that antiretrovirals can be used to prevent sexual transmission of HIV. CAPRISA's origin story is anchored in scientific leadership and standing up for science. The 2000 International AIDS Conference had put Durban on the map as a place of partnerships. Against the backdrop of AIDS denialism and a growing HIV crisis, some of the top minds in HIV rallied to form a multidisciplinary consortium. And from these efforts, CAPRISA was born. There was also a TB crisis at the time, but effective treatment of HIV and TB co-infection was still unknown. CAPRISA developed the SUPIT trial to address this question. It showed that deaths could be halved through integrated treatment. These findings contributed to global treatment guidelines for co-infection, shaping policy and saving lives across the world. And the innovations at CAPRISA continue. Its latest pioneering research is a transatlantic partnership with NIH to study and develop broadly neutralizing antibodies as a long-acting HIV prevention approach.
The strategy of CAPRISA is really what I appreciate the most. In terms of making multidisciplinary science, immunology, virology, genetics, and clinical research, all the basic science is really associated to intervention science.
CAPRISA's research remains firmly grounded in long-term engagement with its urban and rural communities, as it seeks new and better solutions for empowering young women to protect themselves from HIV infection. And CAPRISA continues to strengthen the science base for excellence in HIV research through an extensive mentorship program focusing on the next generation of scientists.
Is needed to ensure retention of children in TB treatment programs. Thank you very much.
And it's a privilege to be here from the United States and recognize that triad of mentorship, giving back, and scientific impatience that will lead to breakthrough that we use all the time at PEPFAR.
And when we talked about support for their initiative, there was no doubt in my mind that CAPRISA deserved the mantle, Center of Excellence, and deserved the support of our department, as well as the world community investing in research and science.
Science excellence, coupled with bold leadership, continues to earn awards for the team.
In 20 years, CAPRISA has made an impact in 4 critical areas: scientific excellence, public health impact, science communication with the public, and importantly, preparing the next generation for science. While CAPRISA continues to prepare for the next pandemics, we remain focused on a world